So, good morning. Nice to see you. Thanks for coming. How was your trip here?
It wasn't too bad, just a little bit of travel, so it was nice to get out of Malaysia town.
Okay. And where do you originally hail from?
So I've lived in a couple different places. I grew up in Connecticut, and then we moved to London for a couple of years, and then Illinois for the last 10 years or so.
Okay, I saw an Illinois address and I was wondering, so you've traveled some. And actually, in reviewing your application, we have something in common. We both graduated from Cornell.
Oh, wow.
And I see that you did a minor in economics. That happened to be my major, with a minor in psychology, so a little flip.
Yeah.
But high above Cayuga's waters.
Oh,
Nice to meet a fellow Cornellian in the process.
Mm-hmm.
So, you were going to say something.
Oh, no, I'm very fond of my time at Cornell, so it's always nice to see another Cornellian, and I was part of the Glee Club while I was up there, so I still know all the Cornell songs.
Okay. I saw that you liked a cappella singing as a hobby, so I was going to ask whether you were involved in anything formal. That's great.
Mm-hmm.
That's great. So why don't we start off with you telling me a little bit about you?
Okay. So I've been, I kind of started out looking at medicine quite a long time ago. When I was younger, my mom was an occupational therapist, so I used to spend most of my time after school at the nursing home where she worked.
Mm-hmm.
So it was actually really nice to get to see like chronically ill patients. Not nice. It was really, it kind of informed my opinion of what illness really was, and I loved it. Right from that age on, and at the same time we were dealing with my grandfather who had lymphoma.
Mm-hmm.
So the combination of those two kind of got me into medicine very early, and just got used to being around people who really need people to talk to, and I think that's what got me interested in psychiatry. That's what got me interested in medicine in general.
Mm-hmm. What are your folks, you said your mom's an occupational therapist. Are there any other physicians in your family?
I have an aunt and uncle in Tennessee who are physicians, but other than that, I'm kind of new, or our family's kind of new to medicine.
Okay. Are either of those physicians psychiatrists?
No, they're both specialists in internal medicine.
Okay. Does your family have thoughts about you pursuing a career in psychiatry?
I think one of the big things with pursuing something in psychiatry is that I think there's a big stigma, especially in the Indian culture, against psychiatric illnesses, and I think one of the big things that would be nice to do is try to break up those stigmas,
Mm-hmm.
to kind of expose that psychiatric illness is present everywhere, and it would really be nice to kind of introduce that culture and kind of tell people it's okay to deal with it openly and talk about these things rather than kind of have it hushed up as it is. I mean, very much so in India, but even here in the U.S., it's still something that's a very taboo topic.
Absolutely, absolutely. So why don't you maybe tell me a little bit about something that was very challenging for you during your clinical years?
I think one of the most challenging things was actually working, when I did my psychiatry rotation at Kings County,
Mm-hmm.
and one of the most challenging things there was dealing with patients who really didn't believe they needed to be there. And that seems like a very common topic. I'm sure you hear about it a lot,
Mm-hmm.
but I think for me the hardest thing was to try and convince them that they needed to be there, and for the ones who, even when they were getting better and they could see improvements, you could kind of tell that they were going to go back out when they're cleared and stop, immediately become non-compliant and kind of decompensate very quickly.
Mm-hmm.
And it's kind of heartbreaking to see that. But at the same time, there are patients who I thought would be like that, and got to see them later on in clinic and things like that, and they were coming regularly to meetings and actually making an effort. And I thought that just being able to get through to those kinds of people would make a big difference.
It is. I mean, that is one of the challenges of treating our patients, is that a lot of times they don't believe that they're ill. That could be the nature of their illness, or again, because of stigma, culturally and otherwise. You've met, I know you met a couple other interviewers earlier in the day. You met Dr. Chamberlain and then Chief Resident Reinfuss, and you had an opportunity to ask them questions. Do you have any questions for me?
I think one of the questions I would want to ask you is, what brought you to this program, actually?
It's an excellent question. I was in my residency, I was a chief resident and in a leadership position. And in my first job, I had the opportunity to be involved in medical school teaching and also supervision of residents. And there was an opening for an associate training director, and I applied for the position and was an associate training director there, and then at another institution, and now became a training director here. So I've always, even when I was an applicant, my then associate training director, when I was on the interview, said, "What do you want to be when you grow up?" And I said, "I want to be you." And she said, "Me?" And I said, "No, not you, personally you, but I want to be in education." I had taught at Hunter College in between my basic science years and my clinical years, and I really, really enjoyed it, so that's why I'm here.
That's great. One other question I was actually wondering is, since teaching has been such a big part of your background, do you find that you get to use a lot of those kind of skills when you actually do your practice as well?
Absolutely. It's one of the models, as you know, is see one, do one, teach one. And I think teaching residents and students allows me always to learn new things from them that I can then incorporate into the patients that I see. And especially even when I'm working with students and residents, it's a collegial environment, and there's a lot of great opportunities for everyone to learn, and patient included. So.
Yeah, that's exactly the kind of environment I'm looking for. I found even when I was a student, I learned best by teaching, and even if I had a topic that I was relatively knowledgeable about, I would be a lot more motivated to kind of become like really sharp on it when I knew that I had to go and present it to a bunch of students, and I became better at it. I get to hear, like you said, you get to hear a lot of other perspectives on it, and I thought that made a big difference in how I learned, and hopefully, seeing how you do it in my practice someday.
Mm-hmm. Speaking about that, do you have any areas of psychiatry that you're particularly interested in?
I think definitely pharmacopsychology is something that I'd like to kind of learn a lot more about. I definitely think the management and titration of different medicines is definitely a very complex field, and I think something that probably still needs a lot more study. So that's something I definitely would like to learn a lot more about.
And you would. What do you think about psychotherapy?
I think it's a very important part of our practice. I think the attending I worked for at Kings County put a really strong emphasis on it, and actually gave me a bunch of papers to read at the time on the subject, mainly because she thought that the best way she was able to get through to her patients was not the first day or the second day, but after a couple days of kind of working them and really kind of getting them to see exactly where they were in life. And so I definitely think that would be a very important part of my practice.
Of course, medication is going to be an important part of anything you do in psychiatry, but in terms of just adult psychiatry, a further fellowship in child, or addiction, or forensic, or another subspecialty, any of those interest you?
I think I've always actually been very interested in kind of pediatric or adolescent psychiatry, which is interesting because I never, I thought after going into it and going to work in where the adolescent psychiatry was, that I'd be totally scared by it. But I actually ended up finding that I connected up with a lot of those patients. I think they go through a lot of struggles that we've all been through, whether or not we had a psychiatric illness that was diagnosable.
I happen to be a child psychiatrist. I personally find it rewarding. And I'm sure you know that we have a child psychiatry fellowship here. And you actually are going to be interviewing later this afternoon over at that site after your lunch with the residents. Do you have any other questions for me?
I don't think, not that I can think of, but I just I wanted to thank you again for taking the time to speak with me. I feel like I learned a lot about your program just from seeing how you how you talk about it. You seem very proud of it, so that's really exciting to hear.
So where are you, my last question will be, so where are you in interviews? The beginning, the middle, the end?
This is actually my first interview.
Okay.
So
Okay.
very excited to be here, and very thankful for you guys offering me the chance to be here.
And in terms of geography, I know that your family, you've lived in lots of places. How do you feel about being here?
Honestly, I've always felt that going to the best programs, the best the best fit for you is the most important thing. Even when I went to undergrad at Cornell,
Mm-hmm.
we lived up in Illinois. It's pretty far away from Ithaca, and the first thing I saw the admission, I was like, I'm going up there. I don't, where the location is less important than the environment and what you're getting out of the place and what you can bring to the place.
Okay. Well, I'm happy to have met you. If you have any questions at the end of the day, you have my card and my email address. If things come up, feel free to call me. And good luck with your endeavors.
Thank you so much. I really appreciate it.